Hi, this is Dr. Elaine Ferguson, and welcome to The Other Side of Cholesterol, Part 5. New York City's Columbia University's medical researchers designed a 10-year heart disease study to determine whether a lower risk for heart disease, also known as coronary artery disease, is associated with positive emotions. Over 1,700 adults, 862 men, and 877 women were involved in the 1995 Nova Scotia Health Survey. The participants were evaluated at the beginning of the study for emotions ranging from joy, enthusiasm, and contentment to depression, hostility, and anxiety. Positive emotions are believed to predict cardiovascular health independent of the absence of negative emotions. Previous studies determined that patients with early onset depression are at much greater risk for developing heart disease, even after correcting for heart disease risk factors such as age, gender, weight, physical activity level, high blood pressure, family history, etc. And this effect occurs even in the absence of a diagnosis of major depression. People experiencing depression have a 1.5 to 2 times greater risk of developing heart disease compared to otherwise physically healthy individuals. Heart disease patients who've experienced a heart attack, stroke, abnormal and dangerous heart rhythms also have a greater risk of developing depression. And after its development, the depression leads to even greater deterioration of the heart. Also, depressed people who fail to respond to a trial of antidepressant medications after an acute coronary syndrome are at even greater heart disease risk. During the course of this study, 145 heart disease events occurred. The depressive symptoms predicted the incidence of heart disease. The study found that the most anxious and depressed were at the highest risk of the disease. Positive emotions protected against the development of coronary heart disease, while depressive symptoms increased the likelihood of disease onset. The researchers determined that positive emotions can be easily assessed, for example, as to whether or not the patient smiles during the clinical interview and if they appear to take pleasure or excitement in the aspects of their daily life. The researchers concluded that this large study clearly demonstrated increased positive emotions are protective against 10-year incidence of coronary heart disease, and suggested that a key to preventive strategies may be increasing positive emotions and not merely reducing depressive symptoms. Thank you for listening. This is Dr. Elaine Ferguson. Please visit our website, www.howtogetwellfaster.com.